Everyone. First of all, thank you very much for joining on this Saturday evening. And, a special thanks to both our speakers today, Mr. Hemang Mehta sir and Krishna Prasad sir, for, taking out their valuable time and joining us today for this webinar to help all your, all such young aspirants who are today joining us. And I would also like to start by a special thanks to Force Biomedical for giving us this opportunity to conduct this webinar in collaboration. I am Nikhil Panjwani from Mindray India. So before we uh, pass it on to our speakers, many of you who have joined here, you all are working in hospitals. What biomedical engineers. So today, first of all, I would like to thank you all. We appreciate you are working in the hospital at the front end, and you are the real COVID warriors. And so before we start the proceeding, this is the agenda for today. We have a 2-hour session, one on basic skills selling skills, and then the second one is by Krishna sir on the key account management and the negotiation skills. So today you will get a brief about the skills required for medical devices sale. And at the end, if both the speakers are okay, we can have the Q&A session at the end. Is it okay, Hemang sir, or you would rather prefer after your lecture?
Yeah, so I had a discussion with KP Krishna Prasad. So essentially, we'll do about 45 minutes each, in terms of presentation. And at the end of the presentation, we can open it for Q&A sessions.
Done.
So maybe
Great.
you can tell us which questions have been picked up, and we'll try and address and answer those. And the ones which may not be the right forum to answer that, we can take it up separately, on a case-to-case basis, offline.
Done. No issues, sir. No issues. Thank you. Thank you. Just to introduce our first speaker, Mr. Hemang Mehta sir is a medical professional. Sir is B in biomedical engineering from Thadomal Shani, Mumbai. And sir has also done his master's in marketing management from NMIS Mumbai. So sir has more than 26 years of professional experience in sales, marketing, business development, and other areas. And sir has also 5 years of experience in nuclear medicine and nuclear radiation detection and identification. So currently, sir is a business consultant at AI Wizards, which is an organization started by 3 IITians on artificial intelligence. So wherein they are specializing using of audio video analytics from CCTV camera feeds. And sir is a specialist when it comes to strategy in the field of medical devices. Sir is also a renowned faculty at 2 premier institutes in MBA for MBA pharma students and MDB program for pharmaceutical companies. Sorry, sir, if I have by mistakenly spelled something wrong.
No, I mean, and just address me as Hemang. That's good enough for me.
Yes, thank you. So what, Mr. Hemang, what I would like to request you is, I've stopped sharing now. You can just start your screen sharing for the audience.
Okay, fine. So would you want to introduce KP first or at a later time? Correct?
Sir, after your presentation
is
over, so then I will introduce sir.
Fine. So good evening, everybody. Give me a moment while I share my screen with you all.
Sir, I just forgot to mention, you can just, the audience can just type in their questions in the chat box. And there is, one small announcement from Force Biomedical. So all the delegates who have come here have participated in today's webinar and, will be staying us for the entire time. They will be sent a e-certificate by Force Biomedical and Mindray India to their respective email IDs. So we request all of you to actively participate, send in as many questions you have, try to clarify all your doubts, and looking forward for an interesting session. Over to you, sir.
Okay. First of all, thank you very much, Nikhil, for that generous introduction. Since we are talking on this topic on sales, so the topic for today is the skills required for sales and marketing of medical devices, and with the perspective for the biomedical students, which I believe is the major audience for today. So, as Nikhil mentioned, my name is Hemang Mehta. And first of all, with this, I would like to take an opportunity to thank Nikhil for arranging this, and also Naresh, who has been doing some wonderful work, and especially in this lockdown, in enlightening students, getting the platforms online, and interacting with people, and arranging for such kind of seminars. So I believe most of us have some product knowledge about the industry. So as Nikhil mentioned, my coordinates are mentioned over here. Please feel free to reach out directly on my personal email ID as meta_hd@hotmail.com. I am essentially a business consultant currently, to a couple of new industries, a couple of new startups like artificial intelligence, where they use CCTV camera to analyze feeds. Then in the field of telemedicine, for some strategic firm where they want to, like have a market research, do surveys, customer satisfaction indexes. So I'm involved, mainly as a business development manager. Right from, my graduation in 1993, I've always been into sales, marketing, and business development of high-tech medical devices and consumables. And like Nikhil mentioned, 6 years, have been into nuclear radiation detection. So this was a little different field and identification, where the application, apart from the medical device industry, was mainly into nuclear power plants, homeland security, explosives detection, steel and scrap market, and such things. So let me move. So that was, the part of my sales introduction. Since the topic is on, sales, so doing a bit of marketing for myself as well, just on a lighter note. Okay. So sales and marketing. Now, these are many a times very, loosely held terms, frequently used interchangeably. When you say sales, and it generally covers marketing, or if you say marketing, it generally covers sales. Finally, it's just a number game. But if you look at a broader perspective, the term sales, it encompasses all activities, involved in selling a product or a service to a consumer or a business. Now, in our case, for this topic, when we say sales, we are referring to the sale of our medical device products to the end user, where the end user may be, a hospital or a doctor, or similar such industry, be it private or government. So that's, generally the term sales. Now, when you refer marketing, marketing refers all activities of a company which it undertakes to promote the buying or selling of their product or service. Now, service, it's a very essential component. Earlier it was when we talk of sales, it generally used to be only a product sale. But in our my remaining slides, a couple of them, you'll also see the services and the software, how it is sold as a service. So that is also becoming a very important aspect in terms of the sales and marketing, in the overall purview. So marketing includes, so there is no, it includes, when we say marketing as an activity, it includes advertising, how you, get your awareness of your brand or your product or your service. So, by advertising, it will also involve selling. It also, and the delivery of products to the consumers or other businesses. So essentially, selling is, a subset of marketing. All right. Okay, so let me move forward. Like any other domain, be it finance or HR, or you just choose, or in projects. So there are always some kind of challenges, and so similar challenges you'll also find for people into sales. Now, what they are essentially, prospecting for good leads. Now, what do you call a good lead? It's not that, this hospital looks good from outside, or this doctor is renowned. Yes, of course, I mean, that's your intelligence and stuff which you gather over a period of time. But prospecting for a good lead is quite challenging for all the beginners. Where to hunt for, how do you prospect? Do you do a cold call? Now, when I started, my career, cold calling was at the helm, at the peak. We used to get down at Borivali, but then depending on the products which were available inside the company, you go there, you go and talk to chemists that, who is a good doctor over here, or, any other projects coming up, in this area. So that was basically cold calling. You just go there, without an appointment, you go and sit there, you give your card. Then, there were other means, or, if the doctor or the concerned person, he doesn't meet you, he or she, then, take a card, connect to them via a phone, then emails, emails were not, very common those days. In fact, in my first organization, we used to have a common email. So, connecting to people was also, there was no WhatsApp, there were no mobile phones. So many, of those. But, now these things are getting much more easier. Secondly, getting a response from the prospects. Now, okay, if you're selling a cardiology related product or a device, or a gynec related product or a device, you have, you're prospected, you went to an area, or by some means on on a phone call or a WhatsApp, or these days, or by some means you got to get in touch with them. But it is not necessary that whether the prospect will reply to you. So that can be quite intimidating. It can be quite challenging for newer guys. Once you get a response, now out of which you'll get 10 responses, but you have to really identify and qualify them as a positive lead. Now, when I say positive lead means, either they are looking, so you basically bifurcate, whether this is an immediate requirement, or, it's just in a very advanced stage of, building a thought process, or, building up a project. So whether it is 1 year down the line. So, you qualify those leads, whether it is a 6 months, or, you have time for this. After that, you have to engage in multiple decision makers at at a company, either a company, in this case, it's a hospital or a doctor or a clinic. Now, if it is just a single user doctor, then, things may be different. But if it is a large, let's say a corporate hospital, or, a bigger hospital where there are multiple decision makers, so, then you'll have to involve the finance, there will be a biomedical department inside, there will be technicians, nurses, depending on, which kind of product you are going to sell. So, you'll have to get, touch base with everybody. Many of the places, and particularly inside an operation theater, this becomes very critical, to identify who is the decision maker, who is the one who recommends, or, is like a gatekeeper. So, you'll have to segregate, that who's the who of, in that decision-making process. Giving discounts, even that can be a little bit challenging. Give me a minute. Okay, so giving discounts, generally, you don't want to enter into a price war. See, if just giving a discount and getting an order was required, then you and I are not required. I mean, you don't have to do a biomedical engineering. You don't have to do your MBA. No, you don't have to do anything. If the only price was the criteria, then none of us are required for that matter. Yeah. So giving discounts can be quite challenging in the sales force, for the sales team or the salesperson. Nowadays, incorporating social media into the sales process. Now you have multiple platforms, by which you can show your visibility. Whether you there are platforms like LinkedIn, where you can share your video, or your product brochure, or something exciting which will attract. Even doctors are very tech savvy these days. Even earlier we used to go out and hand over brochures. Now, even doctors, they ask, the brochures on WhatsApp, and whether they want to, engage with us further or not. So, incorporating this social media into your sales process, can be quite challenging. Standing apart from competitors, it's like how we, promote our products for a particular organization. Similarly, there will be, competitors, be it your friends, colleagues, or, other, people from the industry. So even they will be involved. So, you have to stand apart from your competitor. Now, this could be in multiple ways. The kind of your presentation, the frequency with which you, remain in touch, the way you gather your marketing intelligence. So there are so many factors, which you have to consider. So all easier said than done. I mean, just by reading at the slides, it's to swim, you'll have to actually jump into the well. So, as you go forward in your life, as you progress further, you see your superiors, your business heads, or somebody whom you go around with, see them talk. So all this, it's good to know such things, that be aware of such things. But at the end of the day, you'll have to be in the field. You have to go and learn, make your own skill sets, the way you present yourself. That's all you have to do inside. Once you go inside the market. Now, asking the right questions. I mean, you just go and, sir, are you looking for such and such product? No. I mean, nobody will say yes, or nobody will give you the correct answer. So, you'll have to acquire those skill sets. So these are some of these challenges. Staying motivated. Now, in the last slide, you'll see, what I mean by staying motivated. Because the fear of rejection and the no's, no's, which you encounter in the entire process, can be really draining, really taxing. It can be it can really take a toll on you. You feel that you have said everything, and why you still didn't get an order. So there are so many things. So staying motivated continuously, and for this, we'll have to develop a large network, a large funnel, of sales prospects. That's what the slide, the point number one, prospecting good leads, qualifying them, and qualifying them in large numbers, so that out of, let's say you have 50 leads, so you qualify, like say 25, from which active maybe 10, and finally you get 2 orders. So that's how the entire process is. So you can't just rely, so I have some 10 leads, and out of which 2 are qualified, and both of them, they don't come to you, then they're all gone. So that's one very interesting part of collecting good prospects and in large numbers. Closing deals, yes, closing deal is it's the end process. That's what you are working for. All these things, the challenges which you are you have agreed to face, and finally if you don't get an order, that's quite depressing. Anyways, you have to stay motivated for whatever happens. But closing deal is a very good and a very that's end goal of anything. And finally, once you close your deal, maintaining the customer relationship post sale. It's not just sell and forget. At a later date, I'm assuming you'll remaining in the same medical device field, or something similar. You might have to go to that same customer, and not only from that perspective, but the customer has put in faith in you. So you can't just let them go away, without just raise your hands. Oh no, I'm not here. So you'll have to maintain that relationship even post sale. So that closing a deal and getting a sale is one aspect, but maintaining relationship, networking, that's one of the most important challenges in the sales process, and maintaining them. Now, skills, those were general, the earlier one which I showed, general challenges faced in the sales, the department or sales person. But, so that was applicable even for the medical device industry. But looking at specifically for our kind of industry, the skills which are generally required in medical device sales, I've listed down a few. There could be many more. A few I might have even missed out. So communication, communication, it goes without saying. It's very important for the sales staff. It's communication is anyways, it's important for everybody, but particularly for people in the medical devices field, it's important. Like how right from conversing on the email, how you address the doctor. What is your opening statement, dear sir, dear doctor, so and so. Try to get the full title of the doctor, or if it is a finance head, the person. See, name is very important. Whether you have spelled the name correctly, you have entered the title correctly. These are very, very small things. When you are communicating face to face, yes, but when you are communicating non-verbally, or through emails where you have not made in contact. So the subject material which you convey through, that conveys your entire organization's reflect. And you as a person. When you're talking on phone, how is your tone, whether you're listening. Listening is a very good, a thing which you should have, patience. So, and with a variety of people, with doctors, your approach, your attitude should be different. With a biomedical engineering department inside, I'm assuming a larger hospital where it has a biomedical department too. So, the way you talk with a biomedical engineer, with a finance team. I mean, you don't have to be a financial expert, but some things, some knowledge, some background if you should have. How you talk to nurses, how you talk to technicians, and other people inside the hospital, or all the stakeholders, right? From a medical doctor, the director of a medical trust, or all the professionals who are involved in the entire process of procuring that particular device. Okay. Second is rapport building. Okay, so all sales positions require an element of trust and rapport building. Now, trust is one single letter word which you have to underline. Do whatever you may, never lose trust. So, trust is a very good, a very important element, in the entire process. But for medical, in our device industry, it's much more vital. So medical devices are judged and on their quality and usefulness. It's something that needs to be conveyed by the salesperson, and that requires trust. So I mean, if you are not a trustworthy person, then it doesn't help. In the longer run, maybe you might seal a quick deal, but that's about it. Going further, it will be you are in a major jeopardy. Also, another point, when you say customers, it's not just the external customers which we mentioned earlier, but even internal to your organization. Be it an application specialist. Particularly, let's say if you're dealing with large, like multi-crore equipments like CT scanners, MRI, or ultrasound, or ventilators. Then how your relation with your application specialist. Your marketing head, your BU, the finance, and all of the stakeholders, they also become, I mean, it's not that, you go and start, like having, like just for a coffee or something like that. But, there are many more aspects, how you build trust within your organization, and, you get a few liberties. When you say liberties in terms of, like getting a priority in terms of, giving a justifiable price discount. So, or, getting a priority over a customer where you feel this can add more value to the organization in the longer run. So, all these are aspects which you have to, take care in rapport building, or, the skill set which you have required. Responsiveness, an individual, maybe, like a great, guy and or a girl delivering a sales pitch, but if they are not in tune with the customers, they'll often fail to meet expectations. So, that is one skill which is required. Digital savvy. For people like us, who have originated right from, like writing POs on, paper, quotation, making quotation on paper, right up to the newer generation ones, where, not just a face-to-face meeting, but digital channel means are, they have also a far audience reach. So LinkedIn's, search engine optimizations, reaching the right kind of audience in minimum time. So, if we have those digital skill sets, which, I'm sure everybody would be having, in this newer generation, establishing trust, it's a critical, factor over here. There's a lot of competition. So, what you say about your product, what you convey about your organization. So there has to be an element of trust, which is also, packaged when you talk to the customer, which again, it could be an individual doctor or a corporate. So, like, when you go there, people should realize, okay, when he has said something or he or she, that means, yes, this is it, so that's trust which you build. And it's not just built over, like a day or two, in a year. It's a continuous ongoing process. Product knowledge, like any other industry, even in our medical device, which is more important, a salesperson, needs to be able to reach out critical information about the products or services they are selling. I mean, it's no different in medical devices, I mentioned, but it's essential in our industry where potential clients are likely to have, specific questions, demand specifications. Let's say a very simple example, in an X-ray machine. So, how much, power is being consumed, or, something similar, how many modes are there in your ventilator machine. So, these questions can just, pop up from anything. And if you're not prepared, if you don't have your product knowledge, then it doesn't live in a good taste. I mean, you can always get back to the customer saying that, I will get back, but, you can't get back on everything. So understanding your product, gathering as much information about that, as much information about, the competitors, and, having it handy, I mean, when I say handy, not on a piece of paper, but right here inside your brain. So the more you learn, the more you, go in depth about a particular product. No, you again, it's a skill set to be, required and developed over a period of time. Industry understanding. So on top of the product knowledge, the salesperson need to have an understanding of how it fits into the wider industry. They should be able to explain the benefits, investing in the products you have. So, one is having your product knowledge. What are the pain points, a particular doctor or, a particular hospital or the patients are, having, and how you fill in those blanks. How will your product, at least try to, get to a level where, their majority of the pain points are addressed. Yeah. So in those, so that you have a, wider industry understanding. So that is critical, an essential skill set required. Demo skills, it again, depends on what kind of product is needed to be demoed. I mean, if it is a large, like a multi-crore, 8-10 crore project, a robotic device, then obviously, the demo skills, then a lot of people are involved in that. The place of demo, how many people to be demoed. But let's say if it was, like an ECG machine, or, a glucose meter, or a ventilator, or a C-arm. So, depending on the kind of medical device to be demonstrated, you're required to have a certain amount of skill set, and show it at site, or, at an appropriate location inside an operation theater. So all these are, critical skills which you'll have to develop. Closing techniques, again, getting people excited and, innovative medical products that have the potential to save money, add value to the patient, or, better use resources. That isn't the hard part. Techniques that encourage more customers to agree on the deal, therefore are vital. So, what essentially this means, which I covered in the earlier, slide was, finally, how are you going to close the deal? That's the end goal. So whether, you'll be giving more, like CMC, more, they are, more common like this, but, you innovate such, closing technique skills. You'll give an extra year warranty, or, you'll have a 98% uptime guarantee. So, all these, come handy. And for that, when I mentioned, you'll have to have an internal repo building as well. So these are all, closely interlinked. I mean, you can't just take one skill set as an individual by individual set by itself. But all these things have to be looked in totality. In conjunction with all of them. Relationship management. The relationship management between you and your customers. It shouldn't stop when a deal has been made. So that's just a starting point. So you have sold it. Now see if you can cross sell, you can upsell. If you can enter into that same hospital, into another department. Let's say you had a cardiology product and had a sale in the cardiology department. Then whether you can utilize that skill which that relationship which you have developed, can you transfer it to a gynec department if your organization has that particular product? Because some of the stakeholders like biomedical, finance, they will all always be the same. And then finally you also have an endorsement from the end user now. So if you have built up your relationship, so you can say, oh, your hospital so and so XY doctor in cardiology is already using this, our products. So that is an element of trust, and this is what you mean by relationship management, KOLs, key opinion leaders. There are some doctors who's in the industry, they will always be respected. If somebody endorses your product, see, they will not out and out go and write on a platform that such and such company is that's the best product which you have. But if you had a better relationship with the end user doctor, he can be a little influential. When there are talks, when they go on between when there is a bigger purchase to be done. So always they can refer that such doctor is using it, and you can always take their feedback as to how satisfied they are, or if there are any areas of concern which need to be plugged in. So all these relationship management skills, they come in handy. These are some of these soft skills. They are majorly overlooked when a person handles comes into a sales field. Now, generally when you say sales, you are just looked upon generally as somebody who comes as a with a product and sales. But there are so many other emotional things which you have to be aware of, like traveling. Now, when I started, in my mid-career, like I've almost traveled about 18 different countries, and 15 days, 20 days, I used to be away. And even with my kid, he was about 2 years old that time. So getting that support from your family, keeping in mind that it will be stressful, you'll be away, handling rejections. Rejection means in terms that which we will see more in the last slide. So these are some of these soft skills which you need to be aware of. Many of times the surgeries, things that happen at morning 6 o'clock, or if you are in an emergency like a trauma industry, then accidents and things can happen at any given point of time. So there are some implants, like spinal implants, for which you require, or cardiac emergencies, intra-aortic balloon pumps, or so many such things, pacemakers. They are required, like a quick, and odd hours. I mean, see, cardiac arrest and all, it can happen anytime. It's not that, it can happen. So again, it might not be a daily, like a sales, this thing, but when you are into a, again, it depends on industry to industry, how much, the expanded team support which you have in terms of application, in terms of service. So, for smaller organizations, you have to be, you are in charge of many of these things along with the sales. Gathering marketing intelligence is also, like and in an ethical way. And the next slide will speak more about ethics, but in the right way, getting the right kind of information so as to, support you and use that intelligence to generate your sales, or like you, and finally in the closing techniques of a deal. So, gathering marketing intelligence is also one skill which is required for individuals. Okay, ethics. Now, ethics is something, come what may, you have to follow that, full stop. No questions, no arguments, no discussion on this. So you have to follow, all the marketing, advertising guidelines, like testimonials to be displayed on your website, whether you have to remain HIPAA compliant or not. and cover up all your legal bases when using it, actually on for the patient information. One thing, which is best to, avoid is, unless you cannot prove, a particular point, please avoid superlatives like, best in the industry, most effective, avoid stressing those. I mean, you have to make your point across. I mean, I'm not saying that not, but if you cannot prove it, if you cannot substantiate it, please avoid that. So, also do not use, any wordings that promises results that you cannot consistently deliver. You say, even, just a simple example. When you see this Dettol, I'm sorry to use, a particular brand name, nothing, on that. But, it feels, you can't say 100% of germs because it never does. So, you have to be so sure, but you can claim, let's say, if you're 99% sure, you can put a claim. Okay, I'm 99%, I can, remove all these, bacteria, viruses, when you wash it with this. So, unless you can substantiate your claim, don't put that or don't promise that, which you cannot deliver. Prove your value through your own expertise and skill. Don't run down on a doctor, oh, okay, this doctor, he doesn't know anything. So avoid those, you never know. And it's not ethical also. I mean, see, you don't have that knowledge. We are not qualified to, put down anybody. I mean, we can say good things about us, good things about our company. We can talk good things about our product. But, others are inferior. No. See, there are always segments. Even if you see a phone, there are phones available right from 5,000 to 1 lakh, 1,50,000. So does that mean that a 2 lakh phone is, not a good phone? No. I mean, even a 5,000 phone has its own worth, in a particular segment. So, you can never say that, some things are inferior. See, those are cost benefits. You always weigh the cost versus your benefit which you are going to receive. Secondly, and one of these most important things, and particularly for MNCs, and now even for our Indian manufacturers, our Indian industries, you have always to be aware of anti-corruption laws, and the compliance which you have to follow, the rules of the country, rules of your India, rules in the country of origin. Let's say if it's from USA or Europe. So you have to be, compliant and, in line with the laws, which govern that particular country. Okay. Just give a minute. So coming a little late on this, but, medical devices. So it's basically an article, instrument, apparatus, or machine that is used in the prevention, diagnosis, or treatment of illness or disease, or for detecting, measuring, restoring, correcting, or modifying the structures or functions of the body for some health purpose. So, there are some, equipments are shown like a monitor, like there's a CT scan, there is a, C-arm, there are some, instruments used during surgery. So this constitutes essentially the medical devices, which, we generally, in some form or the other, depending on industry, we promote and, try to sell using the features and benefits, using our skill sets. So, a little difference between the industry which we belong, the medical devices versus pharmaceutical products. So, medical devices are generally mechanical. And the pharmaceutical devices or the products, they are generally the products and, mainly for consumption. They are more of chemical in nature. There is a different efficacy, dynamics of medical devices versus the pharmaceuticals. The R&D, the models, they are different. There are more clinical trials in a pharmaceutical industry. Of course, over here in medical devices also we have R&D, but they are generally a little apart. I mean, they are not the same. They have shorter life cycles. Medical devices, they generally have a shorter life cycle, and pharmaceutical products, they will have generally a longer product life cycle. Sales and marketing models differ. Generally, the pharma industry, they will have a prescription type of model, wherein directly the doctor is involved. Over here, apart from the doctors, there may be many more involvements, like we mentioned earlier, be it finance, biomedical team, logistics, doctors, nurses, technicians. So there are a lot of other stakeholders as well, in our medical device industry. So that is one thing which we have to keep in mind. A capital equipment sales pitch, typically product performance. Generally you have your features and functionality. You go beyond your sales brochure to show how the equipment aligns with the prospect strategy. Whether you can cross sell, you can upsell, and need to be experts not only in technical aspects. Telling one, not like a technical point of your product is one aspect, but how that will have the benefits for the doctor. Maybe it in terms of ease of use. Whether it be in terms of getting an actual a better result. Let's say from a CT scan. Okay, so I have XYZ features, so that will help you in getting the kind of result which you want, the scale with which you are comfortable with, or which is in the prospects business priorities. When I say business priorities over here is meaning the final patient's outcome. What kind of things which the doctor or the end user is comfortable with. And any whether the doctor has been particularly using a particular kind of product. So there are many other performance issues which need to be addressed, which the doctor has to be comfortable with it, or make him comfortable with it, or something like that. Generally, value. When you say value, it's the benefit which you derive from when the doctor or a hospital buys that product. So generally, if there are two competitors in the end stage, and where everything is equal, in terms of the product performance, or let's say in terms of the industry, the brand value, or in terms of their service backup, all those things, if all this is one-on-one, then generally the hospital will go for the organization which has a lower value, lower price rather, not value, but the lower price. This is more applicable in the government sector. In the private sector, there may be many other considerations, wherein which could affect the overall sales or the buying process. Interoperability and integration. Now, most of these hospitals, they are also going for electronic health records and many other digitization and automation. So, if your product, if you can explain that, how easily it will fit into your existing network, then, it gives you a better chance of winning a deal. Service and support, one of the, most important criteria. What kind of service that you have. We as a salesperson, we would be possibly, totally ineffective, if there was no service or support backup. When I say service, it could be terms of, getting our brand visibility, which, the Marcom department do, or our service team, how quick they are in responding. Unless we have that kind of, like faith or that trust in the backup, it's virtually impossible for us, to pitch in our sales, to any prospect. And obviously, it will be visible. You can succeed once, twice, but without this support from the organization and the team, wherein the rapport building comes, all of these things, they all could help you in pitching your like a complete. They help you in your complete sales process and pitching it to the prospective clients. Now, some of the medical equipments, they are into imaging. Now, see, the reason why I'm showing you this slide is, depending on the product, your category, your sales, pitch, and the things which you have seen in the earlier slides, the skill sets may differ. Like for imaging, where you have ultrasound, these are all, high value products. CT scan, MRI, they run into crores, gamma camera, PFT systems, cath labs, Holter recorders, may not be, in that crore rupee bracket, but, at least the other ones, for that you'll require a different type of skill set, in terms of technical knowledge, in terms of, the number of stakeholders who are involved in that. But let's say, if you had just for an ECG machine, then probably, it could be, just at a doctor's level, or, if it was for a ventilator, then even the technicians, or for that matter, heart-lung machine, when you go inside a cardiac OT. So, they should be comfortable using that product. So there the doctors might have a little less say. So no, the reason why I'm showing is this, for a glucometer, you might require a different type of skill set. More of the customer relationship with the pharma industry, the pharmaceutical guy, the chemist, digital thermometer. So your skill set should vary, or you should have the skill set accordingly to the market or the equipment which you are going to handle. So those were all generalized like statements. But when you in a particular industry, which the skills which you should develop, or which are the skills which you focus on, or try to develop in the future for that particular product, they might differ. That's the reason of showing this slide. Some of the challenges and issues in the medical devices market, I mean, just for your information over here, they generally inculcate high cost of production and development, regulations of the government, technology, technology in the advancement, security, most of your data is stored on the cloud. So, these are some of the challenges, which are being faced in the medical device market right now. Product quality, recall rates, localization of medical devices. So all these things, they are generally the major challenges and issues in medical devices market. I mean, just to be aware of. I mean, it's a little away from the topic. Now, some of the medical parks in India, there are about 700 to 800 different medical manufacturers in India. There are many clusters, which have been developed in the last couple of years, wherein AMTZ and Force Biomedical, where because of them we are associated with it. In Andhra Pradesh, there is a big medical park, probably one of the largest in India. And there are many more coming up in, I think, in Noida, Gujarat. Some of these places which are coming up. So the reason to show you this slide is, that there are very high hopes, and there is a good scope, for the medical devices in the industry. So, as biomedical engineers, I think we have a lot of future to see, within the country. When I, graduated, most of the biomedical engineers, I think there are only a handful of left, from my batch in the country and into medical devices. But now with this, the growth, in India particularly, I think we can look forward to, much more, a better future for biomedical engineers. That's what I want to tell. Again, I'm grateful to IBSC, today, again from AMTZ, who in association with AMED, NABC, QCI, they have started some certification program. So see if you can, get some, extra certifications over here, which will enhance your skill sets apart from your engineering, which you are already doing. I assume, it will be probably a BE or a diploma or a post-diploma. I don't know what courses are offered these days, but I would assume BE and diploma would definitely be there. So see if you can enhance your skills, you can add value to your existing work. And yeah, I mean, many of the industries have also started accepting, these skills. I'm, one member of this in IBSC. So just try and look, just to enhance your skill set, make it more appropriate to the industry, in terms of adding value over there. So yeah, thank you IBSC, and again, thanks to Pintray. Yeah, now here comes. Now, till now, what we saw was just the traditional products and stuff. Now there are technologies which will probably change the entire future of healthcare. So 3D printing. Let's say if you want, see, implant is one industry. Dental or knee or hip implant, wherein till date we were selling let's say standardized products, but maybe 3D printing, which we should be aware. You can have a customized implant or a knee implant or something like that. So this industry, I mean, you should be aware of implants, but now you have a customized implant. So your thought process and the entire application would revolve around this. I mean, it will not start from tomorrow, but yes, I mean, you need to be aware of artificial organs, health wearables, precision medicine, telehealth, telemedicine, remote monitoring. So let's say, you are selling an ECG product, a ECG machine, or, like a blood pressure unit. But now, that same thing is now as a service, built as a remote monitoring. So no, you're no longer talking just about just a product. You're talking about an entire different application. Like in B towns, C towns, where there is less access to quality doctors. So remote monitoring will become a very important aspect. Robotics, like virtual reality, augmented reality. They are all going to be the game changers in the near future. Artificial intelligence, I cannot stress the importance of AI going into the future. I mean, of course, there will be rules, regulations, and compliance is required to come into an agreement. But this is one area which none of us will be able to, in any field, forget medical, in any field, this will be applicable. The field of artificial intelligence, and especially like in this times of COVID, even there are softwares and things developed just by looking at it. You'll be able to intelligently judge. So if your eyes can see, hear, or decide, that this is a particular disease, the same thing can be done by using this AI also. I mean, there are a lot of things which happened when I was in way back in 93, 94, when there were computerized ECG machine introduced. So at that time, a lot of doctors also got angry that I mean, are we not competent enough or something? But essentially what we have to convey that there is how do you like how do you build a program inside a computerized ECG machine? It's by taking the feedback of doctors. So I mean, it's very easy to like thoda dar gaye कि ना अरे क्या बोल दिया doctor ने. But you have to understand that these feedbacks have been taken from the doctor who built in that. So similarly, in industry, AI industry, you might face a backlash or something. But finally, it is the doctors who help us in getting that. Okay, this is particular disease. This is what is when you see this, this is what whether it is like pneumonia or it's like a tumor, or what is the size. So this artificial intelligence is always in conjunction with the doctors. When he says that okay, this is something, only then we can inculcate into the program. So there will be backlashes, there will be counter arguments, but then you have to be ready with all your cross arguments, justifications, and stuff like that. Now there is one interesting application, SaaS, software as a service, new avenue in sales. So basically CCTV cameras are everywhere right now, be it warehousing or in security or even in the hospitals. So like if you have to predict stock out, stock outs, if you want to predict that, the staff and the employee behavior ranking, the productivity issues. So like if you want to study, your particular hospital in terms of the number of patient walk-ins, it will be good for even for their marketing department. If you can have how many patients came in angry, how many went out happy. So all these facial recognitions, asset management inside your hospitals. This all can be done by using artificial intelligence. For security, if there are authorized or unauthorized entries, fire detection, contactless attendance, just by facial recognition. And in COVID times, whether you are wearing a mask, or queuing up, as per the social distancing norm. So these are some of these newer avenues which will come out in sales in the near future. Marketing strategies for medical devices. I will not take much of the time on this, but basically it's knowing your audience. Decide whether to focus on medical professionals only, on the facilities or other end users. We have discussed this in the previous slides as well. Build relationships, whether we with the medical practitioner or the influencer, embracing digital technology and employee content marketing. So we have seen this in earlier slides, so I'm not dwelling more on this. Now this is one slide which I want, irrespective of biomedical sales or for any industry or for for you to succeed. There is a book called Go for No. I would, strongly urge that you read this. It's a small book by Richard and Andrea Schwartz. So I've read this. I have this book. So there is one major roadblock standing between most people and sales success. Now, when you hear a yes, be it in terms of an order or you just imagine yourself, in that in that arena right now. I mean, you get such so many positive vibes. You feel so satisfied, you feel elevated, completely elated, and exactly opposite is when you hear a no. I mean, it can be very depressing, draining. All sorts of negative thoughts come into your mind. It's exactly opposite what would happen if you heard a yes. The yes which you wanted. Oh, I got a 1 crore deal or whatever. So, but just imagine. I mean, what would happen if you heard a no? Would you like to achieve your sales quota, hit every income goal? All these things will definitely keep on coming into your mind. But for this, just remember the first thing, the sales funnel, which I told that you'll have to build a very large prospect. Now, the number of no's which you hear, after that is the success. I mean, see, the idea is you keep trying. You fail in one, you fail in two, fail in three. Just get over it, and start going for a nose. That means you're doing more work. More work for the future. I mean, it's just hearing a no by itself can be depressing, but learn to deal with it. Learn to handle rejection. That's what this book says, and this is something which you should get in your life. Start learning and start accepting no as a part of your sales process. I mean, don't get disheartened by it. Don't get upset by it. But look at one no, two no's. At least on the fifth time you'll have like a success. You'll hear a yes. So start learning and accepting no's as a part of your sales process, and go for a no. Go for it. And thank you. And happy to take questions in the end as decided. Yeah. Thank you. I'm done with me myself.
Thank you, sir. So
Yeah.
actually we have. So actually, sir, we have a lot of questions, but as you said, we will take it at the end.
Sure.
Once again, thank you for the informative presentation. We move on to our next presentation. Sir, if you can, sir, just stop sharing your screen so I can just.
Yeah, just a minute.
Share sir's profile.
Yeah.
Yeah, thank you. So we move on to the second topic. Our second speaker is Sir Mr. Krishna Prasad. Sir is a senior management professional in medical equipment and devices and has more than 3 decades of experience in this medical device industry. Sir has worked with various MNCs and has international exposure as well. Sir is skilled in business planning, product management, marketing, branding, sales, development. So you all will benefit a lot today. And Sir is also experienced in various leadership positions for fast-growing companies in medical equipment, diagnostics, surgery specialties with, of course, profit and loss responsibilities. Currently, Sir is working with Invacare Corporation as the business manager for the entire South Asia. So thank you very much for joining with us today. We request you to please share your screen.
Hi, Nikhil. I'm just sharing my screen now. Thanks for that introduction. Nikhil, am I audible?
Yes, sir. Yes, sir. But we cannot see you, sir.
1 second. I'm just sharing my screen first. First, that's okay. You first share it. Hello?
Yes, sir. Your screen is clearly visible. Yes, sir.
All right. Okay. Am I visible?
Yes, sir. We can see your screen. We can see your video now. Yeah.
But I'm not able to see. I don't know why.
No, because sir, once you share your screen, you can see only your slide, but we can see your screen as well as your video.
All right. Okay. Everybody, good evening. First of all, thanks, Nikhil, for that introduction. And before that, thanks, Hemang, for such a vivid description and then good training on the sales skills, right? I also thank Force Biomedical and especially Nituri Naresh for this great platform to having an opportunity for training on sales skills as well as negotiation skills and major account and key account management. Before I move on to the actual topic, I've just given my contact details, my number, and then my email ID. I'm available on LinkedIn and then my Skype ID, right? Okay. So the topic I am now going to discuss is on key account management or major account management, right? So just before this trainings, Hemang have already given a brief introduction on the selling skills. What are the basic sales part of it? How you approach the customer? How do you the entire sales process? Your customer, target audience, then what is the complete process of a sales? So key account management is an extension of your sales and how you maintain your customers per se. For example, how do you manage your customers or accounts? Let me just introduce you what is a key account. Key account is basically an account or a customer. Like in our industry, it's basically the hospital or a individual customer, individual doctor. He could be a surgeon, he could be of any specialist who actually makes a sustainable repeat business for your products from the supplier. Like what I'm saying is, if you are working as a sales representative for your company, what is the business that particular customer is giving you, right? Repeated business, which is of high volumes and high quantities. So that's why I said this, it means more sales and more quantities. So in a key account, what happens is both the supplier, that's mean the company that you as a company representative or a sales executive or a manager, and the organization, that's the hospital or your customer, will work within tandem with the philosophy based on forming a partnership. That means that both of you work in hand for the mutual benefit and collaboration. What does it mean? It means in key account, what happens is because it's a major potential account, potential customer, the hospital also looks for the benefits that they can derive out of the company, the services, the products, the best pricing, the feature advantage benefits of the products they particularly buy from you for their benefit. For their benefit means here, the benefit when we talk about the benefit to the hospital, the customer, it is benefit to the patients. What is the advantage to the patient, to the patients? Ultimately, the hospitals, doctors are serving the patient. So what is the best benefit, the best value they give it to the patient? And that's a collaboration. So that is what basically we call normally as a key account or a major account or a major customer or a big customer, key customer, which means please keep in mind, especially in sales, when we say major account or major customer, we are talking about a customer who can potentially give you a good business, not only just a business, also a customer who is a good reference for you, right? When you would like to go and talk to another customer, another doctor, another hospital, for example, you sold a CT scan to a big center and you would like to go and sell to another hospital or another diagnostic center, individual customer. You always will say, so Dr. X has already got my product, this particular hospital is already using, sir, why don't you talk to them? Why don't you take a reference about our service or product or quality, right? That's where the major account we call. So basically, if you look at the relation or the relationship between the customer, that's your major account, and as a company is on a long-term basis. What does it mean? That's what I mentioned. The relation or a collaboration between the hospital or the customer and the company is basically long-term. So that's why they are called our key customers or key accounts or major customers, right? Three things keep in mind. A key account is one who gives a potential business to you with a good reference of your product, quality, services, whichever the product, equipment, device, instrument, whatever you sell in our industry. And also it's going to be for a long-term mutual benefit, both for the company and for the hospital or to the individual, whoever is a customer. And the relationship or collaboration is on a long-term basis. It's not for a short term. Like you look for a long-term relationship from that customer, and the customer also looks at a long-term benefit, that what if I am going to collaborate or going to work with this company, what is the best that a hospital, as a customer, we also get, right? So going on next, how to manage the key accounts. So the title itself today, we are talking about key account management. So when you are talking about a key account, now you having understood what is a key account, how are you going to manage a key account? That how do you, especially first, when you develop a key account, first step is developing a key account. When you develop a key account, how are you going to manage that account? How are you going to manage that customer? You have gained some good sales from a hospital or a nursing home or a diagnostic center, whichever is the product you're going to work in a company. How are you going to build that relationship? So there are methods to manage. That's why we always talk about key account management as one of the major factors in medical device industry. So the first is bridging skills. You know what is bridging skills? I will explain to you. First thing is how you bridge between you, that means your company, and you as a representative or an executive, and between the company and to the customer, to the hospital. The other thing is building rapport. What is building rapport? How do you build a rapport with that particular customer, with that particular hospital? Having achieved a good business or having bagged some good orders with that particular customer, hospital, how are you going to build the rapport with that hospital, right? The other thing is, having done the bridging skills and having developed the rapport, how are you going to develop the relations with the hospital? When I say hospital as a customer, whoever are the stakeholders in the hospital or in that particular customer are all a part of that, right? So developing the relationship between you, that means you as a person and also the company, and maintaining the relations. It's not just to develop, and you need to maintain that relations. That means you need to have a long-term relationship. And having developed a relationship, you need to sustain that relationship and finally retain the customer. So we have 4 stages, 4 processes, 4 methods to manage any major customer or a key customer. One is bridging the skills, the skills which to bridge between you and your company and the customer. Second thing is building the rapport between you and the customer. When you say you, your team, entire your company, you yourself, first comes you, then your team and your company, and then the entire hospital staff, hospital doctors, whoever all involved in your purchase, everything. Third one is how you develop and maintain the relationship, right? The fourth one is the final stage, having developed that relationship, having a good rapport with the doctors, with the entire staff. Staff means I'm not talking about the office staff. I'm talking about the staff, means the doctors, the paramedical, whoever are involved in the products, right? In the services you offer. They are all the part of it. So how you sustain and retain that relation is the last stage, right? So now let's take it one by one. What are bridging skills? The bridging skills are basically, what is bridging? Bridging is basically, like you say, there is a gap. Okay, how to bridge it? Typically, the skill of bridging is nothing but managing with your sales conversation. Sales conversations means when you go and talk to a doctor, when you meet a specialist, whichever is the product, when you're presenting a product, when you're doing a product presentation, or for example, you're doing a demonstration of a product. For example, you're selling an endoscopy in a hospital. You're meeting a general surgeon and you're talking to the doctor and then doing a demonstration with the doctor in the hospital OT, operation theater, or OR, operation room. How you develop that, manage the sales conversations by making smooth transition between subjects. That means what to talk first, what next, how you want to switch over. For example, you want to introduce the product. Okay, you introduce the product. What next? So you see where are the gaps. What is that I can bridge between subject to subject? How I can build on the, what do you call, your product, your detailing, your conversation of your services, your technology, your concept, everything. So it is a transition between the subjects. How you would like to switch over from one product, one subject to another subject. Like you want to detail the product. So you are slowly bridging it. With bridging is basically making a bridge. That means you are making a construction. You are giving an idea. You are slowly developing that particular concept, driving that particular product into the customer's mind so that he can understand. He will try to get convinced by your argument. The principles of bridging. There are some principles. The main principle is, when you are talking to the customer, avoid abrupt transitions. What is abrupt transition? Abrupt transition is nothing but you are talking on one subject, stay on that subject till the time that particular, for example, you are explaining to the OT staff or the biomedical staff or the doctor on a product, let's say on X product, and then you want to do a next product. Don't switch over from product. Don't give an abrupt transition. First finish it with one and then slowly get into the next one. So bridge the product to product, entire technology smoothly from one to one. Like you should have a story to sell, for example, right? You need to articulate your argument. You need to articulate your sales discussion on your product smoothly and naturally from one subject to the next, right? That's called principles of bridging. So bridging skill is one important method so that you can maintain your relation with the major account. Bridging skills basically are very important, especially in a scenario when you are trying to introduce a new product, a new technology to the same hospital. For example, I tell you, you have sold a product X, right? You want to upgrade this product with a new model, right? Then you have to use this bridging technique, right? Bridging skills will happen. Or for example, you're selling some units to the hospital. You would like to increase the volume of the business, increase the quantity of the business. So you need to use this bridging technique so that bridging skill will help that you are able to move more close to your customer, manage your sales, and also manage your key account. The next one is building rapport. What is building rapport? What is actually rapport? What's rapport is basically relation, but relation to rapport, there is something extra, right? Relation is just relation. Rapport is something beyond relation. It is being rapport is something being very close to somebody, okay? Rapport is, for example, in sales, what we say is when you have some good rapport with a customer, you don't even need to, for example, you have a good relation and rapport with a customer, you can even pick up the phone and talk to him. You can move so closely like that. You don't need to be so formal, right? Sometimes you can informally also discuss with the doctor, discuss with the customer. Even, you can call them at different timings also. So that kind of leverage when you develop, that kind of privilege you have, that is called rapport. So how you get into that rapport, how you develop that rapport, how you build that rapport. There's another important thing. So the building a rapport is keys to success here. What is the keys to success to build a rapport is your project competence. What is project competence here? First, let me talk about, there are three things here. One is the project competence. The other thing is confidence. The other thing is interest. The first thing is, when you talk about project competence, here project means when you're, for example, you're talking about a new product, introducing the product with the customer. Okay, how much competence as a sales guy you have? What is the knowledge you have? What kind of skills you have with respect to selling that product, with respect to promoting that product, with respect to driving that concept, right? Okay, that is called For example, like I said, CT scan, for example, or for example, you are selling endoscopy system or a new system to the hospital. So in that particular project, what is your competence skills? That will finally decide how much rapport you can build up with your customer. So in other terms, in other words, when you have more competent skills, you move very close to your customer. When you move very close to your customer, when the customer is also very close to you, then you are developing a good rapport, right? It is like taking the confidence of the customer and taking a okay from your customer. It's more of convincing the customer. Confidence, basically, the kind of confidence you have, not only in you, the kind of confidence you have in your product, in your technology, in your concept, in your company or services, the kind of number of years you warranty you give, the kind of, for example, nature of the equipment. For example, you're backing the product with kind of technology, spare parts, warranty. So the kind of confidence you have, and the kind of confidence what customer sees in you. That means the customer's confidence in you, you as a salesperson, what kind of confidence you created for your customer, that trust, okay, that faith. This is all one word. So the interest, what kind of interest you are showing in with that particular customer. Like for example, whenever you get a call or you get a contact from them, it could be like for an email, how well you are able to connect to the customer, how soon, how fast. This means it also shows that how much interest you are showing, how much importance you are giving, how much emphasis you are giving to this particular customer. These are all things that are the keys to success to develop the rapport with your customer, right? So going forward, what are the other methods? Offer service. So when you want to develop a rapport, how will you move to close to a doctor? For example, you're meeting an orthopedic surgeon in a hospital who is a very busy practitioner. It is very difficult to get him. Having started developing contact with him, if you want to get a good rapport with that customer, what kind of, like I said, competence with you in your in your product, in your project, and then and what is the other things that the surgeon can see you, the surgeon can probably perceive in you, like what kind of service you are offering, right? The methods are offering service here means what kind of, it could be troubleshooting. For example, when you sell a product, what kind of services you are giving to the hospital in terms of, for example, clinical application, any product demonstration, or after the product purchase is done, what kind of application specialist or product management support you're giving to the hospital, to the customer individually. And be responsive to needs. Whenever customer asks something, how well you are responding. For example, the machine has failed. Okay, you get a call from the hospital or you get that call directly from the customer. How soon or how much you are able to respond to the customer. That is another way. And fulfilling the promises promptly. Like for example, you tell the customer that, look, doctor, I will be able to give you the quotation. Doctor says, okay, why don't you send a quotation in 2 days? So you say, for example, you are not able to give a quotation to 2 days. You don't need to commit that 2 days it's not possible. For example, you're going to travel or it's not possible for you physically. You need to get some support from other people in the department. So when you're promising, you are giving a word to your customer, give carefully, take that time, and when we are doing it, fulfill the promises promptly. Let's say you say, I will not be able to give the quotation in 2 days, sir. Probably I'll give after 5 days or a week. Give that promise, and having said that, after 1 week, truly true to your word, go back and fulfill the commitment. This is where customer sees a genuinity in you. The customer will develop a trust in you. He will have a faith in your words. That's how he also perceives you as a salesperson and also your company, right? After all, at the end of the day, you as a salesperson or the representative, you are the face of the company. Normally, doctors, hospitals look at representatives through that. You are the reflection of the entire company. So you are the key person, right? That's why. So having done that, be courteous and professional. Very important thing I'm saying, especially the doctors. However knowledgeable you are. Like a lot of people think that I'm an engineer, I'm a biomedical engineer. Okay, we have seen even in MBAs working in the field. So when it comes to a customer, doctor, however knowledgeable you are, whatever is your experience, more so in your case, especially I suppose a lot of people are freshers and little experienced, I suppose. So be courteous to the doctor, be professional. When you say professional, what does it mean? When you're talking to your customer, when you're talking to, for example, in a operation theater to a nurse or a biomedical engineer or a specialist, what kind of professionalism you need to show, what kind of knowledge you need to possess, all these are important. On top of it, have that courtesy, right? For greeting doctor, greeting the people in time. When you, for example, if you're late for by any appointment, have the courtesy to say that, excuse me, I'm sorry, I've delayed because of so and so and so. So all these things, like, they also will really give you a long way to build your rapport. Then next thing is ways to develop customer relation. So first I said bridging skills, then I said about rapport. Now we are talking about the customer relations, how you develop a relation with the customer. One is see it from the customer's perspective. What does it mean, see it? Perspective, what customer needs. Like, for example, keep yourself into the customer's shoes. That's called customer's perspective. A lot of times we always say it's my perspective, it's my view, it's my idea. So from the, always think from the angle of customer. If you are a customer, if you are the doctor, what kind of product you need, what kind of application you need. So when you start thinking that from the customer side, that's called seeing it from the customer's perspective. Now share their priorities. So what is the priority of your customer? What does it mean? Like, for example, customer needs a product delivery within a very short time, which you can't do. So that's the priority. Or for example, you are selling 2 to 3 products at a time. Customer will say, for example, I need this product X first, Y and Z. So you look at the priority of customer and deliver it, not that the priority your company makes or your company wants to deliver, right? The services also. So share their priorities. What is their priorities? Note down. Allow them to get it all out or express. What is this get it all out or express is when a customer is talking, when your doctor is talking, let them express their feelings, their ideas, their concepts, their arguments, their decisions, their wants, their needs, right? So get it all out. Let them ventilate. Let them tell what allow them. That means, like Hemang said, the first speaker Hemang said a short while ago, I listened that he said, you need to listen. Yes, in our profession especially, listening is very important. So that's what we say. 80% of the time, let customers speak. You only do 20% of time talking. That really gives a successful selling, right? So allow them to get it all out, express. Let the customer tell. When customer is talking, in the flow of the talk, customer always gives you a lot of information to you, right? So make their problem your problem. Suppose customer has a problem, okay? So some people say it's customer's problem, it's not my problem. No. For example, I'll give you an example. For example, in some areas, especially in India, in remote areas, hospitals, we have seen in few earlier days that lot of voltage fluctuations, the problems due to power in India. So at times what happens, suddenly the power goes off and the product doesn't work, right? Because of power fluctuations, voltage fluctuations, there is a problem. So if that is a problem, you have to look at the problem from the customer side. What is the solution you can offer to the customer? For example, if the product doesn't require as per your work product standards, right? If the product standards doesn't say that you don't need a UPS system or a voltage stabilizer, especially more so in this scenario, you can always advise the customer, because it's a problem for the customer, what kind of solution you can offer. That means if it is your problem, how are you going to resolve it? How are you going to solution, right? That's what. So make their problem as your problem. Now give assurance. Having understood the customer, expressed customers, having understood their priorities, having seen from the customer's perspective, having understood their problem, give an assurance that what are you going to do? What is an assurance? What is that you're going to do? What is that you're going to work for addressing these things, what I'm discussing? 1, 2, 3, 4, the above. Having given assurance, okay, doctor, let me come back to you. Okay, let me work out something. So you're giving an assurance that yes, definitely, we'll look into this matter. We'll look into this issue, sir. I will come back to you. Having come back, you have a plan of action. Check out a plan of action. How do you do the plan of action? It's not just by alone individually. When you are in the office, when you are with your company, the plan of action is done more so by you, your team, your immediate manager, your company. A lot of people are involved. For example, you have the hospital has a problem with the equipment you have sold, and on and off the problem is persisting, like troubleshooting. So you need to involve your technical service, that's customer support people, sometimes the product application support people, your manager, you yourself understand, discuss internally what kind of, you chalk out a plan of action and strategy. So you have to understand the plan of action, make the strategy, and having find the solution, fulfill that commitment to the customer. Like for example, this is done through a customer support guy, troubleshooting guy, right? So you give that assurance, having checked the plan of action, go back to the customer, tell that this is what we are going to do. Then having done that, fulfill that commitment, right? So the ways to develop customer relation is, these are all few finer points where you can really develop that relation, right? So before I move to that, I would like to just re-emphasize. So we talked about how to manage the key account is bridging skills, right? Then building a rapport, then developing the customer reactions, right? Customer relations. And then also, okay, bridging skills, building rapport, and then develop customer relation. And then having developed the relation and rapport with the customer, it's a long-term relation for a mutual benefit. It's a long, having developed the relation also, retaining the customer is very important. What is retaining is, like, for example, you have a hospital, you have the customer buying from your products from you for a long time. It should not so happen that he will switch over to a competition or a company, another company comes in, tries to convince them because the hospital has some problem with you or they're not happy, they will switch over to that competition. You should see that you always retain your customer by fulfilling your promises, commitments, always make customer happy. That's what we call in marketing as customer delight. Customer delight is very important, more so in key account management, major account customers, customer happy. Being customer happy means satisfied customer, right? So they are customer delight. So satisfied customer is very important. So this is how the first part, how you manage your key accounts, key customers. Now, having come to this, the next part, the negotiation skills. Very good. So when we are talking about two subjects here, the first part about basic sales skills and the major account management, negotiation is also part of the skills. What is sales? Sales is a barter system, like you get the product, what you want at the price, what customer needs. It's similar like. So what is negotiation is between two parties, right? So it's a part of a sales process. Unless the negotiation is done and both the parties get benefited, negotiation doesn't happen. Negotiation happens, both the parties get the best what they want, that is called negotiation. So let me take you people through what is basically a negotiation, and then we discuss more on skills required. Okay. So what actually, before you go to go for a negotiation, what does a negotiation mean? When you are talking to a hospital and then finally hospital decides to buy the product, you are getting a signal that I need to go and negotiate, right? Like Hemang already said that the sales process, you develop an account, you go do a cold calling, you first do a prospecting, then once you start prospecting with the doctors, then give you a presentation on your product, demonstration, submit a quotation. So this is all one process, right? The final thing is, what happens is the purchase. Once the hospital purchases or you sell the product only, then only the entire sales process is complete, right? The sales process is not complete unless the product is brought, or we say unless the deal is closed. What is deal is closed means either the deal, the customer is buying your product or competitor's product, or if the customer is not buying anybody's product, the sale deal is not closed, the customer is not closed, the deal is still open or alive, or the deal is now closed because the hospital is not going to buy. That is what I am saying here. So what are the signals where you would like to negotiate, when you would like to negotiate? The typical buying signals. These are certain indications where you will always see, you always have to understand, you always have to gallop it, pick it up, these signals, find out these signals from customers, and then start entering into your negotiation process. Excuse me. Sorry for a minute. See, there are certain buying skills. Like I say, the hospital, yes, I like your product. For example, you're given a demonstration, as I told you. For example, you give a product demonstration, whatever it is. For example, X-ray machine. You're talking to radiographer, radiologist. You did the demonstration. They use the product. They like your product. This, yes, I like your product. Product is good. As the doctor is saying you. Or I say, I think I could use it. I feel, yeah, fine. It looks like your product is good. I can use it probably. Or sometimes they give a signal. It sounds good to me. Yeah. Suppose you say, sir, 50 mm X-ray machine. These are the features. The 3D printing is available, right? Okay. Service is this portable machine. Okay. What kind of quality of image you are talking about? Availability of films, post service, right? So it sounds good to me. The radiographer, technician, radiologist says, right? Yeah, it sounds good to me, right? These are all positive things. But some other thing you're saying, who else is using it? This is what I said, reference KOL. I'll come back to what is KOL. The doctor will say, okay, which hospital is using it? Who else is using it in this town? Who else you have supplied to which hospital, which customer? Always customers would like to inquire about you. So what is that reference KOL? So that means KOL, please note down, key opinion leader. The term key opinion leader has come from key account management. Key opinion leaders are those people who has bought your product, who are utilizing your services, right? They have got a very good opinion on your product. They are the leaders. That means they are the people who can influence. Like, for example, if you, I'm just talking about in general in Apollo Hospital Group in India, a major KOL. Like, so for example, if you go and tell hospitals that, the hospital that, we have already supplied Apollo Hospital, sir. We have used Delhi Apollo, Chennai Apollo, Bangalore Apollo, Ahmedabad Apollo is using it, sir. Key opinion leader. That means one hospital, one customer, one doctor, one group of people who can influence. They are called leaders, opinion leaders. Their opinion matters. They are the people who can influence the opinion. They are called opinion leaders. They are the key opinion leaders, right? Who makes a lot of difference. So the customer is looking here that who else using it? Who is your customer? He wants to know whether you supply this product to somebody else, and who is using. Is a good surgeon, good doctor, whatever is the product. Another point, you say, I may need to order 100 packs units. So for example, if he decides the product and he's already mentally made up mind that, okay, the product is good, I like this product, I probably will use it, it sounds good to me, and probably I'll buy some 100 units or 100 packs. I'm giving, for example, you are selling some consumer product, right? Some 100 units. I may use 100 units, 100 packs. Or you will also, customers say, how about delivery? How soon you can deliver it? Will you do it in a week's time? Or how much time you take it? For example, equipment, normally people ask how much time you take. They'll say 4 to 6 weeks, sir, or 6 to 8 weeks, or 8 to 12 weeks. So he's asking about delivery. So what does that mean? He's planning, he's making up his mind, he's thinking. The customer is already making a plan inside that what is the delivery, all that. And also another question, another signal, another indication is to apply for use. Looks like the product is apply means what? For example, application. For example, ease of use. Like the doctor will think like in my OT, I'm just talking about a product in OT or OR. Okay, the monitor is very good. I think my technicians simply use it. Plug and play, right? Not much of thing to do in a calibration. For example, you take a monitor. Okay, it is very easy to apply and use it. Ease of use, ease of operation. So it's all an indicator. That means the customer also thinking about your product, that the product has a lot of advantages, a lot of plus points. Another point here, another signal is, do I have to decide at once? What does it mean? The customer is asking your signal. So you mean to decide, you mean to say that I should decide immediately? That means he's looking for the salesperson, you as a salesperson, that what is your opinion? You mean to say that I should order now or I can order later? The last thing is, he's asking, how much does it cost? So that means when normally, though I put it last, the nature of the doctor, nature of the hospitals are not only the purchase people, out of curiosity. Like you see, when we also go into the market to buy anything, we always think about our budget versus what is the product cost. right? You always ask immediately, what is the cost of this? What is the model cost? Like, how much does it cost for me? What is the price? So how much does it cost? That means he's also trying to mentally get prepared. What would be the price? How much I have to spend? What is the kind of budget we have? Whether I will be able to spend the money what I have, which is equal to this product, or the product is costly, expensive, or is it economical than what I really think, right? So this is one more. So a lot of indications. So these are the signals, buying signals. What is the buying? The indication that the customer hospital is trying to give you. This could be, this is not only a scenario with the doctor. When you, for example, if you are going to the purchase guy, okay, having done your thorough homework with the end user, like the doctor is satisfied, they said, okay, fine, we are all happy. The customers, the group of doctors, whoever are involved, for example, a machine, equipment. So now you please talk to the purchase people, go and talk to them. The purchase will always ask this, what is the cost, when I have to decide, right? What is the delivery, right? All this. So these are all questions, signals, indications that you will get from the hospital customer that, right, this is the time that I need to submit the quote. If you have not given the quotation, your proposal, whatever is it, right? Quote, quotation, proposal, or once you have given already a quote, a quotation, or proposal, I need to negotiate. So there's a time now I need to pursue. I need to pursue this customer regularly, periodically, to develop the rapport, to negotiate further as fast as we can. So looking at that, the negotiations. What are negotiations basically? That's what this topic is all about, negotiations. What is a negotiation? What do you call the just a simple, very simple form of a definition, for example, in a layman term, it's negotiation is nothing but it is always between two parties, right? It's a mutual discussion between two people. The discussion always two parties, like you as a sales guy, the hospital doctor, or you as a sales guy with a purchase guy, right? Mutual discussions for the purpose of arriving at the terms and conditions of any transaction or agreement. What does it mean? It means that you are discussing with the customer is also in discussion with you. Both of you are looking at a purpose of getting the best out of the product, services, what you sell and what they buy. So the terms and conditions, what are the terms and conditions? Look, if you want to buy this product, this is the term. The term is this price. The conditions are, this is my product, delivery, for example, 3 months. For example, you are selling let's say, for example, as I told you, one CT scan. Okay. For example, my price is this. The conditions are, it is delivered. The delivery period is 6 to 12 weeks or 8 to 12 weeks, right? The warranty is, for example, conditions 1 year warranty. Post warranty, the AMC annual maintenance contract rates or CMC comprehensive maintenance contract rates. These are certain conditions you are putting forward to the customer. The transaction happening, there is a bargaining happening between you and the customer. And then customer also has, okay, if this is the price, can you give this price? Can you give lower than this? Or if you say the conditions are, you say 8 to 12 weeks, can you give before 8 weeks? For example, you say 1 year warranty, can you extend the warranty by 1 more year? So these are all set. So it is like negotiation. It's a bargaining happening between you. That means you and you as a sales guy, or between the company, your company, your company means you, because you are the guy, the front end, you're the face, you're the reflection of the company, and the party who's the other side. Sometimes in a major account, it could be not the hospital, one single individual customer, like I said, one good surgeon, one big customer. He himself is the authority, he himself is the owner of the hospital. He is the buyer, he is the end user, he is the decision maker. So finally, when it comes to negotiations, it is always the transaction, the agreement, the discussions happen between you and the end users. End users, the decision makers more so, right? That's what the negotiation, right? I hope it's clear. So I would like to say here, having Hemang touched that, said that sales skill, negotiation is an art. Okay, keep in mind that no sale, as I said in the beginning before negotiation, no sale is complete until you negotiate in your favor. In your favor means it's not just in the favor of the company, in the favor of company as well as for the benefit of the customer, hospital, right? So always negotiations should happen, win-win negotiations. What is this win-win negotiation? Let's talk about win-win. Negotiations are, when we talk about win-win, what is winning? Winning is like you want to sell your product with the terms and conditions of your pricing, if your warranty, your kind of support versus competition. When we always talk about negotiation, selling skills in sales, there is always a competition. Think that this your like you, the other company also, the other company representative, the other company sales guy is also as smart as you. They also will be doing the same techniques. So it should be a win-win. Like how best you can get the best from the customer. At the same time, the customer, like from the customer, as I said, like see from the hospital. If you are the customer, what is that they can also best get the best. So what does it mean? It means that it's a winning situation for you and winning situation for the customer also. That's why it's called as win-win negotiations, right? Negotiations in which both parties come away winners and both parties are committed. That's what I said, to upholding their ends agreement. That means, whatever both the parties, you as a company is agreed, that the customer, your doctor, the purchase guy, whoever is involved in the decision making process, finally the decision maker agree, both the parties, and commit, okay, to uphold the ends of the agreement. So whatever is agreed in what is an agreement? Whatever that you agree, customer agrees. So you are going to uphold that, and that becomes a commitment. That is why it becomes a win-win negotiation. I will give an example. Like I was telling you, like for example, if you sell one product to a customer, right? So the customer is asking for a price X, and you want to do X plus 2, right? So you negotiate, you somewhere settle between X plus 1, okay? So customer also agrees. That means you have some kind of leverage to work on your price. At the same time, warranty, as I said, like you are saying, sir, my product gives you, for example, I am giving a patient monitor, just very simple product like patient monitor and X-ray machine. You say, sir, 2-year warranty, we will give you maximum. Customer will look, the other company is also giving 3-year warranty. You are giving 2-year warranty only. So what you say, sir, the price is more, no, the price is more because the third, they give 3-year warranty, okay. If it's possible for you, if you are also extending the warranty, right? That means, you are also not losing anything, provided you are also getting the price. Customer is also happy. And they'll say after 3-year warranty, let's work on the AMC rates, annual maintenance contract. I'm sure all your biomedical guys, whomever I'm addressing, are familiar with these terms. If not, I always advocate that please learn this terminology, get more professional. Annual maintenance contract, comprehensive maintenance contracts, spares, accessories. These are all certain terminology. When you get into the medical device profession, especially into the sales, you have to regularly use. You should be familiar when you talk to the customers. So, for example, the purchase guy says, sorry, after 3 years, what is your annual maintenance contract? You will say, for example, sir, I give 25,000 rupees we charge per annum. Or you say, for example, $500. Just giving an example. And they'll say, no, not 20,000. Why don't you make it 15,000 rupees? Or let's say $300. You say, no, sir. Okay, sir, let's agree for $400. I'll give you 20,000. Agree. So now, what are the terms that you and both the parties have agreed? Is agreed between you two. That means the customer also has not lost anything. Customer has won the deal, whatever they wanted from you. You also wanted to get whatever the best possible from the customer, and you also are not losing anything. You are gaining the customer. You are also getting the sale. So it's a winning situation for you. Also, on the contrary, winning situation for the customer. This is called as win-win situation or win-win negotiation. That is why when you are doing this, you are called as a win-win negotiator. The person who is negotiating is a negotiator, right? Now, going forward, what is the closing or gaining commitment? Okay, the gaining commitment is like, what is closing? As I said, finally, after doing the negotiations with win-win, how you close the order. Now, customer has agreed. Now you have to get the commitment from the customer. You have to take the business. You have to close it. You have to get the order. You have to get the purchase order. That means you have to also see that the customer will not do the same thing with the competition and probably try to close. You should take the opportunity of it and try to see that close in your favor so that the customer will be committed to you and the deal is closed. So in this, it is a skill of obtaining the customer's agreement to act by asking a closed-ended question. What is a closed-ended question? What is a closed-ended question? It's like, sir, okay, now we have agreed, sir. Can I take the order today? Customer will say, not today, tomorrow. Why, sir? Why can we do it? No, today I'm busy. Why don't you do it? So try to ask a question in that way that it is a closed-ended. Closed-ended less, you get a question, you get an answer. Sorry, you get an answer only in one way, like yes or no. sir, you want this product now or later? Later. So one answer is a close-ended question, right? So always ask that kind of question so that the customer will not have a opportunity to give a different answer. So having done that good win-win negotiation, you say, sir, why don't we decide, having you decided, why don't you release the order today, sir? I'll wait for you. No, not today. We'll do tomorrow. So that is a kind of close-ended question, right? The type of requests. What is the type of request that you can expect from the hospital, from the customer? Trial use. Like always people say in the hospital, we would like to get the, the trial use. We would like to use a demonstration. Why don't you send this product for a demonstration? Let me use it trial basis, right? Customer use it trial basis. What is the continued use? What is the continued use? Having you gave the demo of the product, the customer is happy and say, you go and ask the customer, sir, I've given the demo, you liked it, can we take it? You say, no, can you extend the demo? Can we use it for a few more days, please? So customer is asking you to continue to use the product at the same level. So first is a trial, you give a demonstration. That somebody, I think a question was there in the chat box I've seen, I'm going to answer them. Continued use, right? Having given that, it's like slowly habituating, like, okay, then extended use. What is extended use? Customer first, you given a trial demo, then he started using it. Now extended use is to get the customer to use more the product. Now first you gave the demo, doctor is using it. Once you go follow up, you say, we have just started using it, continuing it. Once doctor starts using it, liking it, and when I say doctor, it could be anybody, right? I'm just giving an example, any product. Extended use, sir, you ask them to use it, sir, keep it for some more time, sir. So what happens? When the hospital, when your customer is using the product, he is getting habituated, he starts liking the product, right? It is the same thing. For example, if you're using a product at home, any service, when you get habituated, like for example, use of a phone. If you like a smartphone from Samsung, whenever a new model comes, you always get upgrade because you are a fan of Samsung. You like the smartphone from Samsung. Similarly, iPhone today, right? iPhone users, you see iPhone 6, 6s, 7, 10. So whenever the iPhone is extending the product portfolio, new product portfolio, iPhone users would like to buy. So once you use the product, extended use, you get the more and more confidence on the product, liking towards the product. That becomes a commitment, right? That becomes for you, in our case, it becomes a commitment because when the doctor, the hospital uses your product, that becomes some kind of an obligation, some sort of an obligation, right? That's what gaining a commitment, right? So type of closes, finally. What kind of closes? That means how can you close the deal? Direct close, how many do you need this, sir, in a month? Like for example, this product, sir, how many products you would like to, how many monitors you would like in a year, sir, how many? You are now looking at the quantity, right? How much business you would look at, right? You understand, in a year, in a month. For example, you are selling a product, sir, you have promoted 2 models, okay? A basic one and upgraded version. For example, sir, you want this X model or Y model? Basic model or upgrade the advanced model? That either or, like, that means you are trying to ask the customer that different closing methods. Direct close is like, okay, he decided, he will say I want 20, right? Okay. Either a close is like, sir, you want this model or that model, right? You're giving an option to the customer. The one is step-by-step close. Step-by-step close is you are helping the customer, you are advocating the customer, you are working like a consultant to the customer that help the customer decide. Customer is in confusion, customer is in ambiguity, customer is not able to decide what to take, when to take, how to take. You say, sir, why don't you do you take the basic monitor and probably you go to the upgrade version, right? For example, you yourself can decide depending on customer's requirement, customer's need, customer's budget, and customer's value also, what kind of business you can in the future you can anticipate, all those things. So step by step is closing is more advocating role, more of a consultant role from the customer side, right? The last one is summary close. What is summary close? Review by summary that accepted benefits only. Don't add anything new. That means whatever you have decided, whatever you have discussed with the customer, whatever is agreed upon, whatever is discussed between, review the summary. So you talk to the customer, sir, this is what you wanted, this is what we did the demonstration. Look, for example, you wanted advanced version of monitor. We are given advanced version monitor, right? You used it for 1 month. You are happy, sir. We quoted X price. We have given a discount on 10%. Your purchase report agreed. And then finally, we have extended a warranty also. So you are giving everything. You are taking the entire process. You are taking the customer through the journey of entire thing, that you're very transparent. You're very open that giving a summary and trying to close it, right? That customer also will. So it all depends on various. It is not that a thumb rule that you have to follow a direct close or either a close or step-by-step close or summary close. It depends on the situation. It depends. It varies from situation to situation, product to product, services, budget. It's variable. It is on dependent on many variable things, right? So there are different kind of closes. What I mean to say, different kind of closing means getting in order, different kind of achieving business, different kind of creating your sales targets or sales quantities, right? The other one is incentive close. What is incentive close? Very interesting. See, it's like when you are saying, the customer is saying, I will decide, like, let's say the earlier one I said, either or, open-ended question, close-ended question. Suppose you say, so when you want to order, sir, we will order next month. Then you will say, sir, if you order in this month before 30th, you will get this 5% discount. Many a time you see, you will also get a lot of calls from these telemarketing people, credit cards, different. Sir, for example, if you are buying in this month, we'll give this discount, sir. Okay. In the warranty also, for example, when you talk to the people in products like, washing machine, household commodities, they always will say, sir, if you're going to do give a service contract in this month, we'll give 5% discount, sir, 10% discount, sir. We'll give this benefit, sir. So incentive clause, you are showing some kind of a profit, benefit, incentive, some kind of benefit to the customer, which will make customer think, which will make customer to attract, okay, let me get this benefit of this discount and buy it. So there are different clauses, direct clause, either a clause, step-by-step clause, summary clause, or incentive clause. Depending on the situation, you have to play and then do the sales closing, right? Final six prerequisites before closing. What are the 6 important things? Is prospect completely understood your offer. Prospect is your customer. They have understood your complete offer. They have understood their real buying motive, found out and addressed. Why they are actually buying? What is the motive in buying? What is the interest? What is the main application in buying this particular product is already addressed, is already taken care, right? That means these are all the requisite things. If you have done homework properly, carefully, step by step, that is leading to a closing. Customer has confidence in you and your company. Product is good. Customer liked you. You're a salesman. You did a good job. At the same time, you liked your company, service, everything. That is also fulfilled. A well-prepared close. As I told you, everything is done from the 1 to 3 points I said. The customer understood your offer. They know, they liked it. They know that this product which is they're going to buy is going to fulfill their needs, addressing their applications. There is a buying need in it. And then customer also has liked your company in terms of your service, brand, right? It's brand image, application support, product support, troubleshooting, availability of products, spares, availability of people, all that. So well prepared close. So like you're all set, prepared. Anytime customer calls, you're able to go and meet, talk to them and immediately close and take the order, right? The right timing, as I told you, you always have to, like I said, the buying signals, you have to find whether it's the right timing. Or right timing is not just the time when the timing is it you are indicating, you're getting a signals from the hospital customer that this is the time they want to place the order. This is the time they need it, right? Finally, the 6th point is customer has the authority to buy. Finally, the important thing is before closing, you are going to talking to a customer, a doctor who has used your product, who liked your product. After some time, you come to know, this particular customer, this particular doctor is not the right man to influence my product. There is another doctor, there is another specialist who has to also certify. So are you working on it? So you have to always have to work on that also, that who is the correct authority to buy. Okay, I've done my demonstration with the customer, doctor, fine. But finally, the customer doctor says, go and talk to the purchase manager. He has authority to buy. If they say they can't buy, I can't do anything. So that means you also have to work with the purchase people well in advance. That means in the beginning, before closing, all these 5, 6 things are very important, right? Once you do all these things, that means you are set the platform very strong bridge so that you will close the deal in your favor. Another example of point 5, right timing. For example, taking the current COVID situation. Today, if you see, most of the oxygen products, respiratory products are sold in the market. It's an opportunity sales. Everybody understood that products like pulse oximetry, oxygen concentrators, right? All these products are related to ventilators, A lot of companies now talking to the hospitals are talking to the right time, the right product. So you also understand the right timing, rise to the occasion, try to sell the product, right? Finally, I think Hemang has said some new things about medical devices. I would like to also touch on final things is, what are the new avenues in medical devices? Uh, Something new is now digital marketing is now on the rise now, in 3D printing. People are talking about 3D printing to the cone of 3-dimension printing up to the cell level. For example, it is not printing is not just only to the radiology field. Any kind of product you would look at a printer, the kind of printing or getting images for any products to the cell level. Digital marketing is also now today every company is emphasizing on doing marketing, not only the virtual marketing into the field. Digital marketing also is picking up, and it's taking a lot of potential. E-commerce business applications, you all know eBay, Amazon, Flipkart. Most of our medical equipment today are emphasizing on e-commerce business applications, because e-commerce is one where you can reach people, as Hemang was also mentioning, that you can reaching to the people is very, very easy. A lot of you can address. It's basically one social kind of site kind of platform where you address and use your business application to get a lot of buyers. Similarly, products like on the robotic and human assisted devices, a lot of companies are also now coming to robotic surgery. People are talking about in specialties like orthopedics, neuro, gynec, plastics, ENT, cardiac. Robotic surgery is also on the rise. It's a new technology, 3-dimensional robotic surgery. And human assist devices, like, for example, in artificial devices and human assist devices, where, like, for example, disabled, physically challenged, mentally challenged, how these products are used, especially with the links technology and remote joystick technology. Human assisted devices as robotic surgery devices also are on the new products and new devices. That means new companies are coming in. Finally, we are also now talking about a lot of portable and wearability. So you see a lot of nowadays there are watches coming in, something you wear in the neck, something you wear, like the product will give you a lot of readings, parameters, which is portable and which is wearable. Like, for example, I was telling about oxygen concentrator, portable oxygen concentrator. For example, pulse oximeter. You can wear it. You can carry it where it's easily carryable. It's also can be portable. These are all new. That means new technology, new products are coming. Means more new opportunities, new platforms for the medical device industry, right? So I think that's basically I've covered the entire topic in a short about key account management and then how you negotiate with your customers, right? So with that, I end my presentation. A big thank you to all of you for your patient listening, and then any questions and answers, right? We can now go to the questions and answer session. Over to you, Nikhil and Hemang.
Yes, sir. Thank you, sir. Thank you for the very informative talk. There are actually a lot of questions. We'll take it one by one.
Yeah.
So, I mean, you can address those questions, and both or either or we'll try to answer. And like I mentioned, if time permits, we can answer all of them. If it doesn't, I mean, and if there are repeats or some customized answer required, then we can also you can share our numbers, our coordinates with them, and we'll try to assist in the best way possible.
Yes, sir. So Hemang, sir, first question. Sorry. Yes, sir. Sorry, please.
Sorry. Yes, Hemang said, Nikhil, since we don't have time, of course, I showed on the slide as well as Hemang also showed, right? What you can do is you can share our credentials, contact details with the participants so that they can always get in touch with us if they are not able to get satisfied answers here or still some questions are unanswered, right?
Sure, sir. Correct.
Right.
Yes, sir.
Yeah.
So we'll try to 5-10 minutes, whatever we can answer, we'll just try to. Yes, sir. So Hemang, sir, first question for you. In this current COVID times, wherein sales people are not able to meet their customers and all these things. So what change of strategy do you recommend for especially people dealing with capital equipments? This is a question by Prashant. So he handles capital sales equipment, not being able to meet his customers.
Yeah. Hi, Prashant. Nice to see you on this platform, first of all. And secondly, yes, I mean, these are testing times, and a newer approach, is called for. We all hope that this pandemic goes away at the earliest. But my, reading from the markets, at least year and a half, it's here to stay with this coronavirus with all of us, in good company. So, yeah, I mean, see, at the end of the day, the physical contacts, the meeting with the doctors and all, I think that will be reduced. I mean, it's a no-brainer. That let's say earlier, you are meeting, going to the hospital, every week or every alternate day, depending on at what stage we are, in terms of negotiation. Many of the doctors have also, irrespective of COVID, they have started accepting that, even if you have to send a brochure, they don't require a hard copy sort of. A WhatsApp, like Prashant, you might fondly recollect, we used to do that. And yeah, I mean, that's going to be around and quite, in major ways, with all of us. So finally, for a demo, yeah, only time will tell. But yeah, the number of physical contacts and physical visits will be drastically reduced. That's my take.
Thank you, sir. Krishna sir, one question for you. By Abhishek. When you were talking about trust and customer priorities, so how do we serve unreasonable customer priorities and unreasonable demands like delivery period, in configuration, and the price demands, and how do we handle this situation?
So is it question from Abhishek, right?
Yeah, from Abhishek. Yes.
Hi Abhishek, good evening. First of all, thanks for that question, and then thanks for your participation. So what Abhishek means is, if I understood correctly, unreasonable could be on pricing, warranty, various demands. I would say the demands, right?
Delivery period. Yeah. Yes, sir.
The demands which are out of your range, right?
Correct. Yes, sir.
First of all, there are two parts to this answer this question. If a customer is not a key account for you, okay, if he's a regular customer or he's a prospect for you, right? Okay, if customer would like to get the best price to your benefit, and if it is not in your favor, if it's not within your paraphernalia, you have to certainly commit, you have to certainly admit that you can't give that price. There is always something like, there is a limit, there is a lower price limit. When the company says that beyond this, you can't do anything. For example, you gave a discount of 20% on a product. Let's say if we talk about warranty, CT scan, 20% on your customer says, I want 30%. Company says, after 20%, not even 0.1 cent we can give. We can't give because we can afford to lose the order also, because beyond which we can't. So what will you do? Will you go and commit 25%? No, you can't do it. So you say, I'm sorry, we can't do it, sir. And when you are giving an answer, when you are talking to these kind of unreasonable questions, that's what I said in my presentation. Be courteous, show that professionalism. That's what I said. The art of in sales, the art of saying no is a big art. So, okay, you always can use that. I'm extremely sorry, sir. We as a company, we can't do that, sir. We can't beyond that. We can't 20%, sir. I know I will definitely lose you as a customer, but we can't do it, sir. Tell me, sir, how can I help you? If you can help me, sir, with any other thing, can I help you? Right? For example, the customer is asking, okay, price is okay, but extended warranty. The customer says, I want 3-year warranty. You are giving 2-year warranty. Check with the company. The company can be comfortable with 3-year warranty. Okay, company says, okay, we will do 3-year extended warranty, 1 more year from 2 to 3 years. But for example, we need a better price. So these things you check with the company and come back to the hospital. Doctor says, sir, you are giving X price, but I need a little more, sir, because we need to cover the warranty period, because there are spares involved. For example, any product, depending on the product importance, what components, when you talk about CT scan, picture tube, for example, or a circuit. Okay, so this is very expensive, sir. If it goes, it's a major component, a motherboard. So explain to the customer substantially so that customer gets convinced. If customer doesn't get convinced, you can't do anything. Okay, either you play on the price warranty, or you say, okay, fine. The company says we'll give 6 months more warranty, not 6 months. Negotiate. Okay, it all depends on how well you professionally you talk to them and nicely. This is where I said develop a relation, develop a rapport. Okay, always good. Whether a customer is small or big customer, always developing that rapport, building that relation will always help you. Right? Did this answer my question, please?
Yes, sir. Thank you, sir. On similar lines, sir, we have another question.
Yeah.
By Mr. Nishant. So he is asking you, it is perceived that to get an order from a key account, it takes years to build trust. Is it a myth? And to continue, he's saying, I have a problem that one of my ex-colleague who has left the company, he had done some uh, promises that were not fulfilled by the
Understand.
customer. So
Yeah, yeah.
how do I overcome this challenge?
Okay, good. See, first of all, as you said, working on getting a business or orders from a key account for over years is a myth. It's not true to everybody, right? Key account doesn't mean that it's a big customer, big hospital, so I'll work for years. They don't know. There, at times it depends. As I said, it is the right timing, need of the hour, when you are there, how you are presenting the product, the moment you are there, how you are taking to the journey through the journey of entire nurturing the deal, steering yourself, maneuvering yourself, meeting the right people, right time, giving the right contact, right information, everything. That is one part of it. What is it? So it is not always believed that you get orders from business or business from big customers only on a over a long period of time. No, it is not like that. At times depends on the product also. Depends on the product. For example, hospital has a project of buying an MRI. I'm just giving an example. It's a long-term project. You are developing a relation. But when they buy, if they buy your product, because you are developed as them as a major account, key account for you, that is what. Second part, in your case, if your colleague, who is ex-colleague, has left the company and like he has given a bad service to a key account hospital, or the relation is not good, how you build up? Yes, it's a challenge. Look at a challenge, and the challenge, take this as an opportunity. I am not just trying to give an answer to satisfy you, but this is what really we face in our industry, right? All of, I think most of the people agree with this. So what you should do is you start your relation from the beginning. I know in the beginning, like Hemang also said, that no, people will say, I don't want, we know your company, we have met your earlier people. No. So when the customer says no, the challenge starts. Then you have to take that opportunity, meet the people with patience, have that patience. Okay, don't, the tolerance is very important here. Start meeting them periodically, whether they like or not. Over a period of time, when you start going and building, showing that interest, some definitely the people will also understand that this particular person as a sales guy is genuine, he's showing a lot of interest. Having slowly achieved that small confidence and interest, you start building up that relation, as I said. Then start introducing your product. Then also understand where is their pain area. Okay, for example, the product is sold, the product has not worked, there is a problem, troubleshooting is not addressed, or in the warranty some problem happened. Look into that, take this with your management. This particular thing you should to consider, and discussing internally very seriously. You have to extend this matter, you have to escalate this matter with your company, and see what best you can help the customer. And you also tell the customer that I am not coming here for a new business, right? I would like to solve your problem. Tomorrow, if you are happy with the product, don't give me any business, I have no problem. But tomorrow, I will also go and tell XY customer that, look, this particular hospital is using, they were not happy, but today you please ask them. They're happy, sir. We are able to revive them. We are able to give a good service to them. We made the product operational. They're happy, right? This is one way of doing it. Okay.
So extending over here, but like with KP mentioned about taking up with the management, or having a more serious discussion of that. But take it as a challenge. Put it in your KPI, which is a key performance indicator. Yeah. That okay, from such and such account, I will turn a delta. That could be in terms of volume. Yes. Like getting small orders. If it's a consumable industry, devices industry, put some small targets. Delta targets. That okay, this is how I will achieve. Then this is to be taken as your performance indicator separately. So yes, but more importantly, need to be discussed. Involve your management. Let them come and visit the doctor. But if it's like a perpetual, most of the companies, they don't by default, they nobody does it on without any intention. But if the intention is not good, anyways, you'll not get support. But if most of the companies have good intentions, and they will definitely support you, by making like a proper visit along with you, addressing that query. So that shows that you are actively involved, and you are genuinely concerned that you had a bad case earlier, and we are all with you and trying to rectify. What has been done can't be undone, but going forward, and generally people are receptive. They listen to you from both sides, from the management side as well as from the customer side.
Correct.
Yeah, thank you, sir. Sir, we have one question from Peter from Uganda, who has he has written the same question several times. So it's we should get it answered.
Sure, please.
What is the question? Tell me.
Sir, actually, sir, he is saying I have limited investment options. I'm running a small business. I don't have a showroom, not much staff like my competitor has. In our area, there is a tendency to come and see the product, see a feel, look and feel of the product, and then you place the order. So how do I go about as my sales is declining? Competitor is taking advantage of showroom for display of products and closing orders.
Hemang, you would like to?
Yeah, see, basically, what I understood was, the competitors, they have showrooms where they take the customers, and because of, financial restrictions, or, in that capacity, this gentleman, our friend, he is losing his business. See, every market and, every, area, or, every customer will be different. I mean, rather than, crying, on over spilled milk, try to find out opportunities where, you think, where this, this can work. I'm sure, out of those, let's say if you have 100 customers, maybe 10 customers will be receptive to that, to your way, or, to work within your limitations. So try and find out that, rather than, focusing on, things which you are losing because of a certain thing. Now you are aware, that because of this, you are not able to address, a particular segment or a particular, group of people. But I'm sure, there will be 10 group, people who these guys are not, getting involved. And, you have an opportunity over there. You go and, serve their unmet needs. Maybe they are not getting, like a customized service. You go to them, over there, they are forced to come over here. Over here, you go to them. I mean, just try and, just brainstorm. I mean, you have, if you have some people working along with you, try and brainstorm, on some couple of ideas that, how would you like to take this forward? How would you like to, address these pain points? Try to find out, now once you have identified your internal limitations, now, go and find out the pain points where these unmet customers are there. I'm sure, if you go and see him, personally, with your machine, or, your demo within your limitation, I'm sure he'll be more than happy than, rather than, he having to spare his time and come to some other place. So find out those 10 customers. Yes, I would recommend.
Extending that, Nikhil.
Yes, sir.
Extending that, another idea is like, as Hemang said rightly, one is the new opportunities, new avenues, new customer segmentation. That's what Hemang meant, right? The other thing is, let him not look at only the products, what is in his basket. If he feels that with his small investment, whatever the products he has invested, and he is not able to make sale out of it because of this particular simple reason that the product would like to, seeing is believing, customer wants to see, use it, then only would like to buy or purchase, right? Okay, rather than wasting his investment on such products, let him look into new opportunities with those products where he can also invest, and those products, there is a market where those products can be sold or reach to the customer without even seeing, without physically showing the product, which are those technologies, which are those concepts, which are those services today available, which can be a substitute for his business, that can give revenues to him, that can build up sales volumes to him, right? And also look at the new opportunities, like the same product, what he has in stock, look at those customer fragmentation where they don't want, they will also place the orders without seeing, not physically. Like, for example, you do a technical presentation on an iPad or a tablet, or show a video on a YouTube, give that connection, you do some e-marketing, all that. There are some customers who also will buy, right?
Correct, sir. Correct, sir.
That is also another idea. So always have to think, see, the standard kind of thinking today in medical device also is disappearing. What was true yesterday may not be true today, right? So if you are only doing with X, Y, Z products, switch over to your, the thoughts to a new product, new concept, where the products can be sold easily into the market, and you develop your own customer segmentation. Like before somebody else wants to get into that, you be the starter, so that, you are the first timer and you get that benefit, right?
You lead it, rather than, you falling into the trap of other people, who are, putting up, showrooms or whatever. You devise a strategy, for that you brainstorm, and look at products which will satisfy that group of people, and let others follow you. Have that approach.
Right.
Yeah.
Correct, sir. Correct, sir. Thank you. So we'll just take one last question in the interest of time by Dilip.
No, I mean, I'm good, and I'm happy to take more questions,
No
but it
problem.
depends, totally
We are
upon.
here unless the time is not a problem for me.
Yeah.
No problem, sir. So, sir, there's a typical problem of Dilip, sir. He's an engineering pass out, just started his business. So he is facing multiple problems. One is, sir, he's not getting a good MNC distribution, because of, whatever companies he's having, he's not able to sell because he's a new business and not being able to create trust with the customers. So a new startup company, Dilip, engineering pass out. So if you can, sir, just guide him.
Okay. Hemang, first let me answer, then you can give your thoughts.
Sure.
Hi, Dilip. Good evening. Thanks for that very interesting question. This is the challenge even today we face as a company, as I also faced as a company, right? In fact, I would say this is not a challenge, it's a good opportunity. I will tell you, I don't want to name the company. There are a lot of companies who really look for newcomers only, right? When I say newcomer, it's not definitely only a background with a biomedical engineering. There are people who look into a new entrepreneurs. Okay, they are totally new to the pharma and medical equipment business. There are people who are already in the other businesses. Okay, they always think that it's a new set of mind. Okay, right? So what you should do is you should continuously thrive and strive to look into companies. Okay, those companies who would like to partner with you. Okay, with people like you. And what you have to do, you have to consolidate and bank on is your strength, especially your qualification on your side, right? The biomedical engineering background on your side, which is very strong, your technical knowledge, okay, here what I would say is, as a businessman, you need to sell yourself. You as a commodity, you need to sell, you need to show that why you have to be your company. You as a company has to be considered for a distribution of any global company, MNC, in spite of you being new, compared to any other guys who are there in the market experience. You always go with the one thumb rule, I will say, one trump card. One important point is, like, you can always tell them that I come with a fresh mind, right? I come fresh with a fresh idea. I have not worked with any company. So when you consider me as a distributor, a channel partner with me as a company, right? Whatever your company would like to do, right? The company product, offering services, everything, I would like to do along with your company. So that is like growing together. I would like to grow with you. So what are the terms and conditions which are governed by your company? I would like to go with that. Second thing is, it's not a trial marketing for you. When you are going with me, I will put my whole heart and soul, because this is one company I'm going to start. This is going to be bread and butter for me. So I will start from the scratch. I'm an extended sales guy for you. I will work like a sales guy for your company. Like, I have also, it is like I'm establishing your company in the market. At the same time, I need to establish as an entrepreneur in this market with my biomedical background. So what I'm going to do, I'm doing cold calling, I'm going to do prospecting, I'm going to develop the database, get more customers. Okay, talk to the hospital, talk to the specialist, whichever is the product, give the fab, that feature, advantage, benefit. So I do a concept selling, I drive the entire technical selling. So these are certain things which will really make you positive and which will really influence the companies that we should consider this gentleman or this particular company. The finances, of course, definitely come in hand. If you are already financially strong, okay, that really is definitely a plus point. While if you're not really, honestly, if you're not really financially strong, you can always consolidate that. You can always work on arrangement that, like, buy and sell. Okay, right? You also show that income, that no, I also would like to earn revenues from the company. The revenues what I earn, with the margins what I earn from the company, I also would like to reinvest, grow with the company. Or some sort of agreement you can always have with the company, that I would like to work with your company for 5 years. I will work a contract with you, that I will give an agreement in writing that I will not look for X, Y, Z, ABCD companies, especially as a matter of conflict of interest in competition. That also gives a lot of confidence to the company that let's do, this guy is a very, very keen guy. See, ultimately in business, what's his name? You said Dilip, right?
Dilip, yes, sir, Dilip.
Yeah, Dilip, ultimately the thing is, most of the big companies, since you have mentioned global MNCs, I would like to definitely confidently say that global companies always look at one strong thing, is the attitude of the person. Rest or all later, right? This is the approach I think you should have. I think definitely you would be successful.
And like let's say you had a particular company in mind which you're fond of, or for whatever reasons you have an affinity towards that particular organization and would like to associate with. Everybody has something X in mind, that okay, this is where I would like to work for, or this is the type of try to address the markets which they are into, with a non-compete product. Let's say if the MNC, or whichever company, I mean, it could be an Indian MNC, or any other good company where you would like to be associated with it, and selling the products, distributing the product, but try and generate other smaller revenues, but in that particular area, a non-compete product. Develop more relationship with the doctor. That so anywhere if they want a reference, that okay, Deepak, you said Dilip. So, do you know Dilip? Then, they can give you a good reference. And so then, slowly and steadily, they will also be convinced, okay, this is a guy, who has been, into this particular hospital, whether it be, like a key account hospital, or, a key doctor, where, if you should pick up your phone and, call up the doctor XYZ, he should have your number stored. That's the kind of confidence if that company has. Then yes, I mean it's a process. I mean it will not just because you want it, people will not give it to you, but you'll have to work on it and find your way in convincing them. Even after that, it might not be like a success. So like be ready for a rejection, be ready for a no. But yes, keep your end goal in mind. That okay, this is what I want to do.
Yeah, adding on that, Dilip, what you should do is, in a nutshell, show that value proposition to the company.
Yes.
By doing your sales. Your sales is like your self-branding, self-image. Like anytime the company is forced to take you that, they check a reference level. That's what I said. Reference level, have some handful of customers who can tell them that this guy is damn good. Your self-branding, your branding, your value proposition, and you're selling yourself, like your image. That will reinforce any company, rather force the company to take a decision in your favor. Right? Thanks.
Yes, sir. Sir, one question from Nigeria by Mr. Aminat Abraham. In this COVID scenario, how do we approach customers with a tendency of delayed payments? Can you suggest some innovative solution to this problem?
Or that is, you're talking about account receivables?
Yes. And the second thing is, also because of this COVID situation, there are, a lot of lead supply gaps and, a lot of orders cancelled. So, some strategy to convince customers.
So first is account receivable. Second is the supply problem,
yes,
right?
Yes, sir. Yes.
Demand versus supply. Am I right?
Correct, sir. Yes, sir.
Amin Abraham.
Yes, sir. Aminat Abraham.
Yeah. Hemang, shall I go ahead?
Please.
Yeah. Look, I mean, what you should do is, I know it's definitely a challenge, especially in COVID, to recover the money. I hope you understand what we call in India as accounts receivable. So yeah, if you're not physically able to go to the hospital and meet, I know it's difficult, but the first solution is only if you can meet the customer, your hospital, if it's possible. I'm just asking if it's possible, if it's try out the solution, whatever the way you would like to go and meet. If it's highly impossible, okay. But if it's possible, best solution is to meet the customer face to face and discuss, bargain, negotiate, and then you try to recover your money or get some commitment. If not possible, you use all the mode of communication, your phone, telephone calls regular to the customers, then sending emails to them. If the customer is close to you, if you are using in your area WhatsApp message or any other social media communication, utilize that. Try to reach the customer, send some nice messages, try to pursuance. You continuously pursue the customer, so that also show that there is nothing wrong. Say that if COVID is not only affected you, COVID is affected everybody. Affected you means as a customer, you tell the hospital, your customer that, sir, I am also affected. The business is at loss. We are not able to recover the money. So we definitely need money to survive, to reinvest, to supply you. Okay. Also link up, sir. I'm not able to supply the product to many hospitals, including your hospital, because I am also not able to invest. I'm also not able to buy the product from the companies, because back and forth, I need to also pay money to the companies, right? That's one way. And coming to the answer of supply demand, you definitely have to explain the situation to the hospital that why the product is you are not able to supply. If the product is in your shelf and you are not able to supply to the hospital, there is a genuine reason that you should tell them how you are not able to reach them, right? And then you request the customer that whereas from the hospital, some representative of the hospital, some representative of your customer, some staff, some employee can always come to your premises, your office, and pick up the goods. Take that's the deliveries. This way you can also deliver, right? If the challenge is itself is not able to supply in time, the shortage of product or scarcity of product, if you know that the company whom you are representing, the company which product you are selling is not able to supply, explain to the customer, tell the very truth. Like for example, this product is in demand worldwide, the product is in shortage, the product manufacturing itself is slow, the product is not available to many countries, so it definitely takes some time. Please kindly you have to bear with us, sir. You tell the truth, there is nothing wrong. Okay, definitely in the bargain you will lose the business, but this is what happening to many customers, many companies, many business partners. But having explained the truth to the customer, being genuinity always will, you will also find out other ways and means. For example, if the hospital is buying X product from you which is not, you are not able to supply, try to get compensated for the new business. You also ask them, sir, for example, this particular product is available, why don't you give an opportunity for me for this product? Maybe the hospital is not buying that product from you, but get an opportunity to sell that product, right? Thereby you also compensate for yourself that whatever the losses you are making the product X, get the same thing in another product, right? At the same time, you also retaining the customer. Third thing is customer also thinks he is genuine. He doesn't want to lose it. That's why he wants to supply something to us, and then he wants to be a retained. He wants himself to be a retainer for as a supplier to the hospital. All these factors will also influence the hospital. Also will think hospital about you in a positive way, and then they can always try to retain you, right?
So yeah, continuing further, this is where the relationship building, which we both mentioned, will come into play in such time of crisis. I mean, if you have helped in the sense not only in terms of pricing, but in terms of giving your service, your backups. If you have done well in the past, most genuine hospitals, customers, they will definitely support you, in some way. You might not get a full payment. You might get a deferred payment. Or at least something, some priorities or some additional benefits, which you can get in this time of crisis, which you may be able to command. So that's where the long-term relationship will definitely help. Yeah.
Hemang sir, one last question. Actually, many biomedical engineers have requested. So I'll just read it out. Actually, multiple variants of that questions there. So one, Mr. Hemant says, I am a biomedical engineer working in a hospital. In these tough times, what are the additional skill sets I should learn to be competitive in the industry and to ensure job security? So this is a common question that many people have asked.
Okay, so KP, I will answer that. See, developing your skills, in the biomedical course, I don't know what is being taught currently, but if you can touch base more about, brush up more on your computer skills, have a little bit more about, AI, machine learning, yes, or let's say 3D printing. I believe there were some courses also which I saw, floating around. And if you are on this platform of Force Biomedical, there were some courses on 3D printing. So develop skill sets which will be useful in the future. Yeah, I mean that's what I would recommend in this current times, in this challenging times.
So
think a little bit more, what is valid today, may not be valid after 10 years. So, invest your time, currently in things which will be there. That's why, that one slide on the future. And, KP also showed one, which, it's more or less aligned in that direction. So
yeah.
Keep that
adding on to that, Nikhil, Hemang. So adding on to that, Nikhil, what they can do is, for example, especially what Force Biomedical, I'm sure IBS, everybody knows Indian Biomedical Society skills. That's if you go and log on to the site, the Indian Biomedical Society is now going to advertise and give a lot of courses. Like, for example, they've already started running the course on the quality control program for 45 days for experienced professionals like you. I don't remember the Nikhil. What is the guy's name who asked this question? The biomedical
Hemant.
Hemant. Sorry.
Hemant.
Hemant. Yeah, and that's one. You log on. I think there are new courses. The new courses are going to come, which are definitely useful for your technical skills. Second thing, as Hemant said rightly, now big data. People are talking about data science is a big subject now. Data science management, big data, which is ultimately going to be going to make a big role into all medical device companies, into digital marketing, even into when you are looking at clinical specialist jobs, product management side. Big data is going to play a big role with what knowledge of artificial intelligence into software skills. You can also touch base on some specialized courses on medical software, which will also run into these days, especially in US, in Europe, people are talking about medical coding, medical software courses, where you equip with yourself apart from your biomedical knowledge of troubleshooting, maintenance of your equipment. That means you are also looking at different avenues to make yourself strengthen that you are a potential resource, even in the event of COVID, with the scarcity or the job insecurity. When you are equipping yourself with these kind of courses, you get more qualified. You will be considered for new positions in biomedical companies, in hospitals. That means you have to add up new skills, right? So one is Indian Biomedical Society courses. Also, there are institutes by the Government of India, Department of Electronics and Communication. Advanced training institutes are there, where you have electronic processing instrumentation. In few cities, you have these courses for the biomedical professionals. You can do online courses also available now. You please log in, search, and then get those courses there. After all, they're not very expensive, very economical also. These are few things you can really develop these kind of skills in these tough times to make yourself abreasted with the knowledge, and also keeping yourself positive on the knowledge side as well. Will that answer the question, please?
Yes, sir. Thank you very much, sir. So, sir, with your permission, sir, what I will do, I will post both of your email IDs in the chat box. So if anybody has, there are a lot of other questions unanswered. So if anybody wants to get in touch with you personally,
yeah,
that I'll do. And so once again, sir, I would like to thank both of you for your valuable time today. Thanks very much to Force Biomedical for giving us this platform. Are any words you would like to say for the audience?
From my side, first of all, I once again would like to thank Force Biomedical, Indian Biomedical Society, and more so him, Nikhil, your company Mindray Medical, for giving an excellent opportunity and platform for conducting this webinar. And it is a pleasure for me to be a part of this. And I think most of the participants, I'm not sure how many number, but I think I feel that with so many questions coming in, and Nikhil, you are saying a lot of many questions to be answered.
300 plus, sir. We touched 300 plus.
Very good. So that shows that a lot of people, showing a lot of interest in this webinar, will only really give me a positive vibe that, well, biomedical engineers, biomedical professionals are really, very active, and we need to take this to a different platform. So I really thank everybody for the active participation and the cooperation and the time everybody spent, right? Especially again, Mindray and Naresh from Force Biomedical. Thank you. Of course, thanks big Hemant for that good start and keeping the tempo good.
Thank you. Yeah.
So thank you, sir. Hemant sir.
Okay. So anything from Naresh, some inputs?
Yeah.
Actually, and then we close it. Yeah, after that.
Yeah, I think so. Naresh sir is not. He has not joined. Somebody else from his login ID has joined.
Oh, okay, no worries.
Oh, no problem. Okay. He was on mute. We thought, but he's definitely.
No. He
would like to say something, Nikhil. At the end.
Sorry, sir.
Nikhil, would you like to say something?
No. Actually, sir, I've already said it was, a great opportunity, great learning experience for all of us today. In fact, I also, got a chance to learn from you both.
Thanks.
Speakers. Thank you, sir. Thank you for your time once again.
Thank you very much. Bye.
And I'll send your email IDs in the chat box if anybody wants to.
Please do.
You can log
in. Right. Thanks, Hemant. Thank you all. Bye.